I'm going to, meeting is now being recorded. So, welcome then to the first of the Hahnemann Clinic for Heilkunst presentations. We decided to do these. We did them many years ago and then kind of forgot about them, but this is something that people found very useful, and we'll tackle a number of different topics, either seasonal or just topical. The first one I thought would be useful is just to talk about how you would use homeopathy, although basically we use the term Heilkunst simply, as I'll explain, it's not strictly speaking homeopathy the way we're using it here, but how would you use this energy medicine at home? Now that's an interesting question. Why is homeopathy, Heilkunst, interested in teaching people how to use this at home? Well, this is a very American thing, I think. Once homeopathy came over from Europe to the United States, where it really flowered for a long period prior to the invention of antibiotics, that there was this movement of pioneers from the eastern seaboard into the interior of the United States, and of course there really were no doctors out there, and homeopaths decided that they didn't want to leave their patients without the help of homeopathic remedies, and so they created these little kits and gave them to them and gave them certain indications. Use this remedy for this kind of a situation. And many of these pioneers went off with these little homeopathic kits, and this became a tradition in North America. You don't find this so much in Europe, but it's a very great tradition in North America, and it's one that we have promoted and fostered mainly because if you know how to treat a lot of first aid stuff, it makes my job a lot easier, makes any practitioner's job a lot easier. Sometimes you do need some help and assistance when it gets a little complicated, but in most cases you can do all of this on your own, and it's amazing what you can do on your own. Now we call this first aid, of course, because this is while you're waiting for someone with more knowledge to help, or you're on your way to emergency department. There's a lot that you can do with these remedies, and I know from my own personal experience with my own family, and I know from hearing this from patients over and over again, that often by the time they get to the emergency is over, which means you don't have to wait 3 or 4 hours in the emergency room of the hospital to have someone see you. I don't know why they call the emergency part of the hospital when it takes 3 or 4 hours for someone to look at your case. So we're going to explore this in a very preliminary way, but I'll explain as we go along. The main idea here is just to give you a basic idea of what's involved, and also to point you in the direction of what you can get and what you need in order to make this work for you. Okay, so basically the important thing here is it works. If you give the right remedy for the right situation, it works every time. I once had someone ask me if homeopathy worked. I said, well, if you give the right remedy for the right problem, it always works. That's the trick. Now, with first aid, that's very simple. It's not like treating chronic disease and complicated disease conditions. These are mostly fairly simple cases where the remedy is readily identifiable. And if not to you, certainly we can give you the resources to make it readily identifiable. Okay, so the first, what do you need? Well, you need, like the pioneers of old, a basic remedy kit. And the good news is that there are companies out there that supply these kits. And they contain anywhere from 12 to 150 or more remedies, common remedies that you would use for most acute situations. Now, many of these situations go beyond first aid, of course, and we'll cover this in another patient teleconference, things like how do you deal with coughs and colds and whatever. That's not first aid. but that is a little more complicated and requires a greater range of remedies. You know, there could be 24 different remedies for coughs or for colds. But for first aid, the remedies are pretty basic and straightforward. The nice thing about this is it's simple, it's portable. You can take it with you on your camping trip, you can take it with you on your vacation down to Cuba or Mexico or wherever, and it's relatively inexpensive. As you'll see from one of the cartoons there, and I'll explain, you do not need to use very much. Each one of the little tubes or vials that are in this box contains these tiny little pellets, and all you need is 1 or 2 of those tiny little pellets dissolved in a bit of water or even straight in the mouth, and that's a dose. And there's literally hundreds of those little pellets, and you can also get refills if you need it. But when I used to use these things many years ago, you never run out, basically. So it's a one-time investment of anywhere from $50 to $150, and that's it. So this is an example of a kit, a bigger one. I think this contains 100 remedies, so you can see it's not very large. These are tiny little vials. They pretty well last forever. There's no best before date. Homeopaths have done experiments where they found remedy kits from old homeopaths. I remember I came across one with a patient, had been donated. It was over 100 years old. We tested the remedies. They still worked. So these are never going to go out of date in that sense. And we'll come back to this at the very end, but there's 2 online sources in particular, Washington Homeopathic Products and Natural Health Supply. But all you have to do is Google, which everyone can do these days, for homeopathic remedy kits, and you'll find a number of companies that produce these. They're all more or less the same, sometimes a little bit different in terms of the choices you're offered, etc. What else do you need beside the remedy kit? Well, you need a basic how-to guide, and it needs to be simple yet comprehensive and easy to use. Now, there are lots of books out there for homeopathy or homeopathic prescribing, but I wasn't really happy or satisfied with any of those, and I wanted one that was focused essentially on first aid. So I sat down and wrote one and made it available. Now, I'd make it available for free, but publish it through Amazon.com, and they don't allow you to do that. So I made it as cheap as I could, which was $2.99, but once every 90 days they allow me to put it up for free for 5 days. So we'll put a notice out when the next time comes. If you don't want to pay $2.99, you can get this book, and it gives you all the details you need in order to use a home remedy kit properly for first aid, essentially. And what you find in the book is the basic principles. I think that's important, that you understand what you're doing, but it's not complicated. It's very straightforward. That you also have, the main part is a remedy guide, which gives you the remedy to give for a particular first aid situation. Finally, you get a resources section, and this tells you how you can get what you need, and also how you can learn more about Heilkunst, homeopathy, prescribing, etc. And finally, the last thing you need is really just a little bit of confidence. And that's partly what this patient teleconference is designed to do, is just give you the confidence that anyone can do this. And it really is simple. As someone once told me, once you understand it, it's just a walk in a park. So we're going to take a little walk in the park of homeopathic first aid prescribing, just to show you basically how simple it all is. Well, first of all, first aid is about shocks and traumas that need immediate help. So first aid is any kind of aid that you can give someone while you're waiting for more comprehensive or professional help if that's necessary, and sometimes it is, but often it isn't. And what is the best first aid? Well, the one you can give immediately. And if you have a little remedy kit and you're traveling, doesn't matter where you are, then you can give assistance right away. You don't need drug prescriptions, you don't need to carry drugs around, you can carry these anywhere. And it's very portable. I once gave a first aid kit, a small one, to a nurse that was going to some trip in the South America, and everybody started to get sick, and these were all nurses and doctors apparently, and she used her first aid kit on everyone. And a lot of these people had had their immunizations, they'd had their various drugs for nausea, antibiotics or whatever, but none of that was really working, and she just used her first aid kit and helped everyone. And what kind of first aid can you give immediately? Well, the one that you know and that you can use safely. So of course, you're not going to try to do anything unless you feel comfortable doing it. And the nice thing about homeopathic medicine is that it's safe. You can never hurt anyone using it. The worst that could happen is that nothing happens. Okay. So, Heilkunst, or homeopathy is the more general term, is safe, effective, and easy to use immediately. You don't need to be a rocket scientist. You don't need a lot of knowledge to use it effectively and safely. So let's take a look at the ABCs of first aid. The key to first aid in Heilkunst, and this is the reason it's really Heilkunst, not homeopathy, because homeopathy is very much based on symptoms. But with first aid, you're not really dealing with symptoms, you're dealing with a cause, a specific shock or trauma that needs to be addressed by a specific remedy. So for each shock, there is a specific remedy. Shock A always requires remedy B, which gives you C, or the cure. Very fundamental, but very simple principle, and you can depend on it. It's not a matter of which remedy do I give for this, and there's 20 to choose from. It's what is the shock, and then very quickly identify with your knowledge or your first aid guide, what is the remedy for that shock. So let's take a very simple situation. You get stung by a bee. There is only one remedy, generally. I mean, in extreme circumstances, there could be a few more, but there generally is one remedy that will deal with the problem of a bee sting. And that is a remedy made from the honeybee itself. Apis mellifica. That's it. So once you know that, anytime you get stung by a bee, you can use Apis for a wasp sting, but you can also use a slightly more specific remedy, which is a remedy made from the wasp itself, which is Vespa. But if you don't have Vespa, because many remedy kits don't have that, you just use Apis. You'll find out later on when you study this in more detail that Apis is a wonderful remedy for any kind of swelling or allergic reaction, for example. If you have a physical shock, which we call a contusion, usually a blow by a blunt instrument, or you bang yourself, and what comes up generally is a bruise or bruising, which is called a contusion. there is one remedy which everybody tends to know, which is called Arnica montana. And it is good for any kind of physical blow affecting the soft tissue of the body, which generally will produce a bruise. Now, if you give arnica quickly enough, I've done this to myself. I remember one time I hit my thumb with a hammer, which we all do, I'm sure, one time in our life. I happened to be at a place where I could get the arnica. I immediately took a dose of arnica. Not only did the pain go away, I didn't get the swelling and I didn't get the bruising. Because if you remove the shock fast enough, then all the symptoms that are a sign of the body reacting to the shock, they don't show up. They're not needed. So the faster, the more immediately you give the remedies, the better results you get. Now, if you do get a persistent bruising, despite your efforts, and this happens because the venous blood gets coagulated and stagnated, then there is a wonderful remedy called Ledum paluster, or in some places Labrador tea, which works great for getting rid of these persistent stagnant bruises, even old ones. Here's another shock that is quite common around the house, workplace, etc., a sprain or a strain. Well, the sprains tend to involve I've got them mixed up now. In any case, one involves the muscles, and if you have a muscle strain, then you use a remedy called Rus toxicodendron, and Rus is made from poison ivy. For some reason, it produces symptoms very similar to muscle strain. On the other hand, if you sprain yourself like an ankle, as this picture shows, which involves the ligaments and or the tendons, then basically use another remedy called Ruta graveolens, or Ru, as it's called in other places. Another shock that's also common for people, particularly at the cottage or with an acreage or whatever, clearing land, is poison ivy. And the specific remedy for that is Rus toxicodendron, which is made from poison ivy. The pioneers used to actually make a tea from the young leaves of poison ivy in the spring and drink it, and it would act as a prophylactic against their exposure later in the year as they were clearing land. So they had some kind of comprehension of this idea of the law of similars. Another all too common shock is burns, and burns come in different degrees. I think there's four. I'll just deal with three here because the fourth one's pretty bad. First degree would be like a sunburn, even a bad sunburn, but there's generally no blistering yet, and there's a wonderful remedy, cantharis. A second degree would be blistering and burning through a main layer of the skin, which would be very similar to a kind of phosphorus burn, which is the remedy that we use, phosphorus. And finally, the third one, third degree burns, which are much more serious. There is a remedy called morphinum, which is actually made from morphine, but you often don't get morphinum in the remedy kits. And so you can use instead the phosphorus, or you get the morphinum if you need it from a practitioner. The picture here shows essentially a second degree burn. Okay, if you imagine a sunburn, which we've all had, that's a first degree. The second degree is what you see. The third degree is much, much deeper, burning through deeper into the layers of skin, and the skin generally isn't moist. It's burned severely but dry. Again, all this you can find pictures of this on the internet and everything. I remember a case with my kids of sunburns, for example, and they got burned pretty badly one time when we went down to Disney World, and just gave them cantharis for sunburn, and the pain went away. They woke up the next morning, there was no blistering, they felt fine. Okay, what about nerve injury? Any kind of injury to the nerve, whether you crush the nerve, you cut the nerve, you damage the nerve in some way, we have a wonderful remedy called hypericum, and this is St. John's wort, which in herbal senses is used for many other things, but we essentially use it for nerve injury, and it's very wonderful for getting rid of nerve pain, even strong nerve pain. Part of first aid in our system is dealing with emotional shock. And these are things that happen, again, all too commonly or frequently. And the main one here that we've got is fear. A shock of fear, and there's a wonderful remedy, Aconitum napellus, which is a flower that often grows in people's gardens, aconite. It's also good, interestingly enough, for any trauma to the eye, because anything that gets in the eye or gets lodged in the eye also creates a tremendous degree of fright, even if we don't feel that way. So that's one you can use in that situation, in addition to other remedies, of course. Another emotional shock is abuse or assault, where you feel like you're being abused or berated or assaulted, whether it's physical or emotional. Also sexual, of course. Any threat to our sense of bodily integrity. It could be a cut or a puncture, it could be an injection, or it could also be an emotional shock. And the remedy for that is Staphylos aureus. Very, very commonly used, because we have a lot of those kinds of experiences. Now, what I just gave you was for very simple situations, simple causes: bee sting, a burn, nerve injury. But some situations are complex. And for some, you also don't necessarily have the right remedies in your remedy kit. As a practitioner, I have all those remedies, but you don't necessarily have those in the remedy kits. They don't sell many of those. But you do have options in these situations. So let's take a look at a few of those. A simple cause with a complex of shocks. You cut your finger. You just cut your finger. One thing happened. But in this situation, you have a number of shocks that are happening to your body. You have the bruising or the contusion shock, so you need arnica. You often involve injury to the nerves, so you need hypericum. You have an assault, bodily assault on the body, so you need Staphylos aureus. And often there can be a frightening situation, so you would give aconite, particularly in the case of children. Another example here is whiplash. Again, all too common in many situations. Here you have a shock to the head, where the head is whipped back and forth. Well, for the shock to the head, you need arnica and natrum sulfuricum. But the actual shaking of the brain inside the head, there's a remedy called Helleborus. And finally, the injury to the spine, which involves the nerves, all the spinal nerves running from the brain down the spinal cord, requires hypericum. So any kind of whiplash, you would use those remedies. You can also have a complex situation. For example, and again, this has happened. You hit your thumb with a hammer, you fall down the ladder on your back, and you twist your ankle all more or less at the same time. So here you face a number of particular shocks to your system. So we're looking at remedies like arnica for the contusion, the bruising, hypericum for the nerves, the hellebores and the nat sulph again for the injuries to the head and the back, the spinal cord. You also have sprained and twisted your ankle, and your muscles often are strained as well. So these are all the remedies you would need: arnica, hypericum, hellebores, nat sulph, rhus-tox, and ruda. Now this may seem a little bit complex at first, but once you understand the basic principles and you understand the situation, the formulas come fairly readily. And all of this information is given in the book, basically. Now sometimes you don't know the cause. Not usually in first aid, but sometimes you don't. A good example would be nosebleeds or internal bleeding. Now if you do know the cause, such as a blow by a blunt instrument, or you fall against something and suddenly you get what seems like internal bleeding, then you would give arnica. But if you just have internal bleeding, and a very common one is nosebleeds, for example, there is a remedy, ferrum phos, or iron phosphate, which works wonderfully for any kind of internal bleeding. You might know the cause, but you don't have the remedy. For example, in poisoning, you don't always have the specific remedy which would be made from the poison. That would, because there's any number of poisons that you could run. You know, a child drinks kerosene or something, or you don't always have kerosene in your remedy kit. Chances are you don't. But there is a general remedy you find in all first aid, homeopathic first aid kits, which is called nux vomica, made from a poison nut. Now there is also a better approach, which is a formula for detoxing any kind of poison that you're exposed to. And that involves three remedies: arsenicum, the nux vomica, and sulfur. And those three together work wonderfully at helping your body to detox. So those are the kinds of situations that you come across. And basically, I just want to summarize here again that what you need is a first aid kit. They are readily available. They come in different sizes, depends on what you want to spend, but they last a lifetime. They're portable. You can carry them anywhere. You don't have to worry about them being carried through x-rays at the airport or whatever. Homeopathic remedies basically will survive any kind of X-radiation. So you don't have to worry about that in terms of traveling. And you can share these with anyone else based on the Good Samaritan principle. That's what the idea of first aid. Of course, you would use it on yourself and your family, obviously, but you could help other people, as this nurse did, just simply in the Good Samaritan principle, particularly if you're traveling. So here you have kits anywhere from 330 to 100. We have these two online sources, Washington Homeopathic Products, which you can just Google online. It's called, the website is www.homeopathyworks.com. There's also a company called Natural Health Supply, a little longer URL or website name, but you can search on Natural Health Supply. There's one or two in Canada as well. There are a number of others around the world, particularly India, maybe in Europe. And again, the basic guide, as far as I'm concerned, there's really only one good one here, but you know, if you find another one, that's great. It's in electronic version, so you can put it on your iPad, iPhone, your computer. You can carry it around with you. You can print it out too if you want. It's affordable and sometimes free. Here it is on the Amazon.com listing. They have a different cover picture for some reason. And finally, that confidence that I talked about. But as I've shown you, the principles for first aid are very, very simple once you understand how it works. And you'll have the remedy guide with you, and it's not that complicated. Not that many situations in first aid. The situations are fairly limited. It's just a matter of, in complex situations, just thinking a little bit about what's involved in that particular first aid situation. How many traumas are we dealing with here? And in that sense, it really is just a walk in the park. Once you get to know this, you won't want to go anywhere without your remedy kit. Any chance of having a PDF version? I don't have a Kindle electronic reader. Amazon now has it so that you can simply download the Kindle app onto your computer or onto your iPad or iPod, but if you just have a computer, and you can read the book on your computer using their Kindle app. That's what I do. That's how I read those books. I can't put it in PDF because that would violate the agreement I have with Amazon.com. Can paper remedies be used if the remedy is not in the kit? Yes, if you understand the principle of paper remedies and you feel comfortable with that, of course. You could not only dispense with the remedy kit, you could create basically your own pharmacopoeia whenever you need it. And you would be able to use a specific remedy for a poisoning or whatever. Okay, so we'll stop here, and I'll open it up basically to any other questions that people might have. I'll just try to go through them. Why purchase kits when I can just write on paper? Yes, exactly. If you feel comfortable with paper remedies, you don't need to purchase the kit. I do that because not everyone feels comfortable with or accepts the idea of paper remedies. Do you have to use the remedy immediately? No. You can use it minutes later, hours later, days later, years later. I mean, I treat many people, of course, who've had shocks and traumas that were never treated, and that's years ago. But the sooner you treat for it, the faster the results are going to be. You get rear-ended and have whiplash, but cannot get to your kit for a few hours. Will it still work? Yes, it'll work a few hours later, a few weeks later, a few years later, a few decades later. How long can we keep the remedies? Forever. As long as you're alive and longer. You can pass them on to your children and your grandchildren. Is it safe to use the homeopathic remedies after the listed expiry date? Yes. The expiry date is purely there to get by the materialistic mindset that cannot understand that something can last forever, like energy, and needs to have an expiry date on it. There is no expiry date for homeopathic remedies. Assuming that one has the option of different potencies, what do you recommend in terms of best potency and the frequency of taking remedies? Good question. Essentially, you will be offered a number of choices. Usually these choices are in what we call the C potency scale. So 30C, 200C are the most common potencies. Sometimes you'll get a remedy kit with a 1M. These days, I would recommend you get at least the 200C. The 30C kits used to work really well years ago, but for some reason, because of the nature of the way we're changing and evolving, it seems that we need higher potencies now than previous generations did. So I would get at least a 200C kit, and if you want and can afford it, you could also get a 1M or just get the 1M, because in acute situations, the higher potencies generally work better. I don't think the price is all that much different in terms of potency. Frequency of administering. Generally speaking, the more acute the situation, the more often you give it, and then as the person improves and recovers, you give it less and less. A quickest way to do this is if you're using the remedy kit, you just tap, and you have to learn how to do this, because otherwise you'll pour all of the little granules into the water, but you have to tip it slightly and just tap it with your finger until a few granules come out. All you need is 1 or 2 little granules in a half a glass of water, and just stir briskly, and then you just get the person to sip on that every few seconds, and then every few minutes, and then every 10 or 15 minutes, every half hour, depending on how severe the situation is. Generally, you'll notice things start to improve very, very quickly, just as this example I gave you with me hitting my thumb with a hammer. Very, very painful. Another situation I'll give you, where I was working with a circular saw, and for some reason I cut with the circular saw, electric saw, right through my finger, and it essentially took the whole, just under the fingernail, down about ½ an inch, all of the top of my finger off. Very painful, a lot of blood. I was in shock. I got the remedies within about 10 or 15 seconds. My wife ran and got them for me. The pain stopped within about 5 to 7 seconds, and the bleeding stopped within about 10 or 15 seconds. I also applied some pressure. We put calendula cream on it right away. We bandaged it. I didn't have any swelling. There was no pain. And within about a week, the body had grown all the skin back, plus the nerves had regenerated, because we also gave the remedy for the nerve injury. So in that finger, I have not lost any of the nerve feeling. If writing it on paper, can we just write 1 dose as needed? Would that work? Yes, you can, if you feel comfortable with that. Paper remedies are based and work on the idea of intent, and if that's your intent, but it's often better that you focus on the situation, and that you basically keep focusing on it. Now, if you write the remedy and you give it to the person on a piece of paper, generally the remedy will keep working. How do you write paper remedies? You just write the name of the remedy and the potency, and you give it to the person, or you put it in their pocket, or stick it under their pillow if you want to do it at overnight time. What was the name of the websites to order? Cannot scroll. Well, this will be available later. Jason can also send out an email to everyone with the websites for the kits to order, and a few others that are available. Okay. Let's see. Do you prepare composite remedies for a complex case such as your finger? Do you mix all the remedies together, or did you take them separately? I just mix them all together, because you have a complex situation, and what you need is a complex remedy. So you basically put all the remedies together and sip on them, all the ones that you need. Now, occasionally you will miss one. I'll give you an example where a person had a whiplash, and they forgot to put in the remedy Helleborus. And so they recovered about 80%, but there was some part of the whiplash injury that they had not gotten rid of. And when they came in, they said, I treated for it acutely, etc. So I checked the remedies, and we found out that Helleborus had not been given. And when we gave Helleborus, the other 20% of the lingering effects of the whiplash disappeared. Had another case recently where a child had a shock in their timeline, and it involved an animal bite, and arnica and aconite and staphysagria and I think hypericum were given, but it didn't fully clear. Now, in the case of a dog bite, there is a wonderful remedy that is made from the saliva of a rabid dog called lysin, which you give in almost any situation where an animal bites you. We gave the lysin, and that completely cleared up the what was still blocked from that particular trauma. Calendula cream can be given right away, yes. Calendula is a great remedy for regenerating the skin. I can't emphasize that enough. I've seen so many cases, and I just gave you one in my own case, where it'll literally grow the flesh and the skin back very, very quickly. You can almost watch it happen day to day. I can give you many examples of that. What about if you have food poisoning? Does the remedy include that also? Well, as I pointed out, you use arsenicum, nux vomica, and sulfur. And all of those three remedies are included. Now, food poisoning, the specific for food poisoning is arsenicum, but you can also add in nux and Staphylococcus aureus. There's another remedy for fish poisoning, which is slightly different, which is carbo vegetabilis. But again, all of this information is in the book. The dog bite remedy, well, you'll find in the book, I believe, it's Lyssin. Now again, that's a hard one to get. Not a lot of remedy kits include that. So sometimes you can do what you can do, and then you contact your practitioner, and you may need to get some more specific remedies just to clear that final little bit that you can't clear with your own remedy kit. Or if you know how to do paper remedies, you can do that. Or if you don't know which remedy you're missing, you contact your practitioner and he or she can give it to you. Do you recommend anything that can help with cold weather-related body aches and flu-like symptoms? Well, that's a different topic because that's not first aid. That's getting us into acute prescribing, and that becomes much more complex. But we will try to do one of these patient conferences on acute prescribing. In this situation, all I could recommend is you talk to your practitioner because those situations are more complex. There are many, many reasons why you have colds and flu-like symptoms, and they're not simple, mostly chronic. Okay, are there any other questions? I see people making comments and chatting, and that's fine. I just want to make sure we cover any questions that people have tonight. Calendula gel versus calendula ointment, different uses. Yes, they are slightly different. Generally, the calendula cream is the best. And again, they're not all equal. We supply, and I think Washington Homeopathics used to have a calendula ointment that really worked. I've tried a number of other ones and they don't work so well because they don't put enough calendula in the formula to help regenerate. So they do seem to be different, but the best is calendula cream. Can you recommend something for blizzards? I'm not sure what that means. There is no remedy for blizzards. You have to talk to the weatherman or God about that. Bone breaks, yes. I didn't mention this simply because there is a wonderful remedy for broken bones called symphytum, which the pioneers used to call knit bone, because that's exactly what it does. It'll knit your bones together. Do not use that remedy until you are sure that that bone has been reset. Because if you take that remedy when the bone is broken, but it hasn't been reset, when it can be reset, the bone will start to grow together almost immediately. And then it's almost impossible to reset unless they re-break the bone, and you don't want that. Do you recommend succussing the remedies when taking? I usually put in water bottles so it's possible, but is it necessary? No, it's not necessary to succuss. But some people feel better doing that, and you can. but it's not absolutely necessary. We do carry a calendula cream made by a compounding pharmacist that we know, and it's a wonderful calendula cream. I use it all the time. So if you can't find it anywhere else, you can talk to the clinic. We don't normally sell products, but we do carry those that no one else seems to sell. Does arnica cream work as well as granules? To a point. There is a difference between applying a remedy externally and internally. But if all you have is arnica cream, then use the arnica cream externally. Do not put arnica cream on any broken skin. It will create tremendous irritation, something that the medical system calls erysipelas. So it has to be on non-broken skin. Calendula cream is what you put on broken skin. Okay. I've heard a lot of people say that homeopathic medicine in India is not the purest. Not sure how far it's true or if that makes any sense. Well, if you mean by pure in the sense of classical, the homeopathic prescribing in India is varied. It varies all over the map, but the dominant type of prescribing is what is called either first aid or keynote prescribing. And first aid, as you can see, is not classical homeopathy. You're not using the symptoms. You're not relying on the symptoms. You're relying on knowledge of the cause. And keynote prescribing relies on a few very characteristic symptoms, and that works quite well in acute prescribing. Of course, that doesn't work well in chronic prescribing. Okay, yes, in India they teach classical homeopathy, but because in the early years there was a lot of lack of education, and many people used it at a village level, they had to come up with this way of teaching, which is called keynote prescribing. I've studied with a number of Indian prescribers, homeopathic prescribers, and they're very, very good at it. And it works, as I say, in acute prescribing, but it doesn't work in very complex chronic situations for which you need Heilkunst and sequential prescribing. Is weakness of muscles after injury covered by first aid? Well, yes, if the weakness of the muscle is caused by an injury, then it would be covered by first aid. But the weakness could be caused by an injury to the nerves, or it could be caused by an injury to the muscle or to the ligaments and tendons. It could be caused by an emotional shock. I've seen situations where the weakness was caused by the shock of fear. So all the physical injuries and traumas were treated for, but the fear was not treated for. And the remedy that we give for fear is opium. Unfortunately, because it's called opium, it's not readily available. But there are some first aid kits that sell it under a different name, which is, I'm trying to think of it. No, they have different names. I can't think of one right now. But aconite is another great remedy for fear on an acute basis, first aid basis, as I mentioned, and that works really, really well. But to the extent that the weakness is due to injury, yes, it can be covered by first aid. Now, the other thing you need to remember is that injuries can trigger deeper chronic problems. So even if you remove the acute situation, the patient may be left with problems, symptoms, weaknesses that weren't there before, and then you have to go to a practitioner because you're now dealing with something which is chronic and complex, that was hiding, that was dormant, but that was awakened by the trauma, the acute trauma. Is there any remedy to slow down a racing heart, not due to fear, but atrial fibrillation? Well, now we're out of first aid and we're into something else. Now, there are some remedies, and they're covered in the book, for first aid situations such as sunstroke, where you can have a racing heart, you can have an irregular heart caused by sunstroke. and there are excellent first aid remedies for that. Papaver, yes, thank you, Julia. That Papaver somniferum is sometimes found in the larger first aid kits. But if you just have aconite for first aid, that's fine. And then, presumably you can connect with a local homeopathic practitioner or the one you use at a distance and get any other remedies you need. And of course, if you use paper remedies, once you know what it is, you can apply it right away. If we carry the remedy kit out of the country, can we get a letter from clinic? Yes, we will supply a letter to anyone if you want to travel with a remedy kit. But if they insist on putting it through the x-ray or whatever, or opening it up and sniffing it, let them. The x-ray, the opening of the vials and that cannot destroy the energy that those kits are carrying. Okay, any other questions? We're coming on an hour here, which is roughly the time we allocated, but if there are any other questions, I can certainly address them. What I'll do is I'll just leave, let's see if I can go back here for the kit, so I'll just leave this page so you can see it and copy it. This has been recorded, so you can come back in, or Jason will make available the site where the recording will be, so that you can go back in and listen to all of this again. But I would definitely recommend that you take a look at the more comprehensive book electronically. As I say, it's easy to carry around. You put on your iPad, your iPhone, and have it with you all the time. Yes, a good suggestion. You can do a print screen of what's on the screen right now and keep that information. Okay, well, thank you for attending. We're hoping to do 2 or 3 of these a year, so if you have any suggestions for topics you'd like to cover, again, they have to be relatively simple. We can't start tackling very chronic complex cases, which would require me to explain what I spend 4 years teaching to students so they can learn how to do that. But if there are some simple situations like how do we handle colds and flus in the winter season, etc., we can definitely tackle that. And hopefully, as I say, we can build on this and you'll have a little bit of a library and resource section to use this. I think the most important thing for us, for ourselves, and as parents is to have the confidence and knowledge that we can do something, that we don't feel helpless. It doesn't matter what it is. Someone cracks their head open, they get stung by a bee, bitten by a rabid animal. None of these things should hold any fear for someone who understands how to use homeopathic remedies in first aid. I even got a call once, I'll just finish this, when I was first starting my practice I don't know how he got hold of my name. It was somebody who was in the Army Rangers or the Green Berets, and they were out in the jungle in Georgia, and he was on his cell phone. He called me. He had been bitten by a brown recluse spider, and he told me that the fatality was 50% and that someone had given him my name in his troop to call me for the remedy. I said, well, there's not much I can do. Back then I didn't understand paper remedies. I said, there's not much I can do about this because you probably don't have any homeopathic remedies. And he said, yes, I have a little remedy kit. Again, where he got it from, I don't know. In any case, I had him take hypericum and ledum, because of course he didn't have the brown recluse spider remedy, but he had the remedy for any animal bite, which is hypericum and ledum. All remedy kits contain that. And I had him stay on the line, and within about 5 minutes, he was breathing better, he was feeling better, and the poison line that was moving up his leg or arm, I don't remember, was receding. Of course, in a case like that, the poison starts to move pretty quickly. So there's a lot you can do even in seemingly serious situations. And again, this takes you right back to your pioneer ancestors, and they headed out into the bush with just a little remedy kit to face the bears and the wild animals and the tetanus and the chopped fingers and you name it, the burns, and all of that was handled very, very well by a simple first aid kit. The granules can be given directly in the mouth versus dissolving in water. Yes, but in an acute situation, they go a lot further if you dissolve a few in water and have the person sip constantly. The more acute the situation, the more often you want to give it. Now, if you're using a paper remedy, of course, that's not an issue. Okay, well, we're called a night, and thank you very much for attending this first one, and we'll hope to see you in the next one.